Nursing shortages and high turnover rates are common in hospitals across the United States. This presentation will examine a potential solution to this problem on an oncology unit in Flint, Michigan. The oncology unit faces several challenges. First, there are staffing shortages on night shift. Overall, there is a shortage of experienced registered nurses, especially on night shift. There is poor employee retention, as experienced employees tend to leave for other positions. This is a common phenomenon nationwide. While the average employee turnover rate for all industries is around 15%, healthcare workers have a turnover rate of 20% or higher. Retaining RNs is one of the most important ways to prevent RN vacancy. The mission statement is as follows: to build and retain a staff of high quality, highly satisfied registered nurses to better serve the oncology population. The vision statement reads, the oncology unit will deliver excellent care with a staff of highly satisfied, expert nurses. A SWOT, which is strength, weakness, opportunities, and threats analysis, will be performed to evaluate the current climate of the oncology unit. First, as a strength, there is a tight-knit core of experienced nurses on day shift. The unit has a dedicated nurse educator who can focus solely on the needs of the oncology unit. Finally, the hospital offers relatively high pay compared to other acute care settings in the area, which attracts staff. There are several weaknesses. The staff consists mostly of inexperienced nurses on afternoon and night shifts. There is a high turnover rate. There is a high rate of staff dissatisfaction. CNA shortages create additional work for nurses. Finally, shortages cause frequent mandatory overtime. All of these things can contribute to burnout and RN vacancy. There are several opportunities. First, a nurse leader could implement interventions to improve staff morale. This may include simple things such as acknowledgement and praise of employees. The nurse educator can educate new nurses to create a group of expert oncology nurses. The emotional climate should be examined and modified to create an environment that fosters RN and CNA retention. Finally, classes could be provided on stress management and burnout prevention. There are threats to the ongoing success of the oncology unit. First, experienced nurses may leave for other positions or retire. Second, high acuity and increased patient census create additional stress for nurses. An environment of high stress can cause experienced nurses to vacate their positions, and knowledge of the work environment can frighten away potential new nurses. The aim statement is as follows: to decrease RN turnover and burnout, by December of 2018, all RNs will attend a class on burnout, stress management, and compassion fatigue. Nursing leadership will implement a policy of praise, encouragement, and acknowledgement. As a result, turnover rate will be less than 15%. The stakeholders in this situation are the RNs. They will be engaged through classes and through positive encouragement and acknowledgement. An effective way to accomplish these goals is by use of servant leadership. Putting the needs of the RNs first and serving them by meeting their needs will help to solve the problems the unit faces. RN vacancy is a problem nationwide. For the oncology unit discussed in this presentation, creating an environment of positivity and educating staff on stress management and burnout prevention can help to solve the problem.